Research indicates that as many as 1 in 5 teens suffers from hearing loss, much of it caused by noise damage. More and more doctors and school band directors are urging children to take precautions against hearing loss and, in some cases, even supply them with earplugs. The audiology specialist at Lake Ear, Nose, Throat, and Facial Plastic Surgery explained that high-decibel music from instruments, concerts, and earbuds, in addition to other loud noises, can lead to irreversible hearing damage.
When we test children, we take a history from the parent, preferably. We look in the child's ears. We test the child in the booth, either using something called visual reinforcement audiometry, which is a remote control toy that has lights and movement. So we train the child when they hear the sound from one side of the booth to look to that side, and then the toy comes on to reinforce them. And then the sound from the other side, if they'll look, then the toy comes on and reinforces them. That's visual reinforcement audiometry. A child 6 months old can turn their head and can easily do that. A little older child, we use conditioned play audiometry, which is holding a block up to their ear, and when they hear the sound, drop it in a bucket, or give somebody high five every time they hear it, or say beep beep when they hear it. Just some type of response every time they hear the sound. So those are the two major ways. The older children, 5, 6, 7, can raise their hand when they hear the sound. When a young child has a hearing deficit, it affects how well they acquire speech and language. And so a 3-year-old, if they're not hearing well, they're not going to acquire speech and language in a timely fashion. I mean, they're going to be delayed. So their hearing it's very important to have good hearing just in those earlier years.
For more information on the audiology services available at Lake E&T, please click on the Hearing Loss Story link on our homepage at yourhometownhealth.com.